8:30, and the Senate Public Health and Welfare Committee will be called to order. First up, we do have two bill hearings today. And if you guys recall, I did ask everybody to keep 20 minutes for each bill hearing. That's all we're going to have time for. We did not hear back from anybody that said that would not be acceptable or would limit them in any way. So we are going to go ahead and proceed. So on Senate Bill 425, looks like we have three testifying. So if you could please keep your testimony under 6 minutes, that would be greatly appreciated. If you keep it under 3 minutes, you're a rock star and you get a round of applause at the end of the hearing. So something to look forward to work toward. So first off, we're going to have a bill overview by Jenna Moyer in the Revisor's Office.
Thank you, Mr. Chair. Good morning, members of the committee. Senate Bill 425 amends statutes related to the disclosure of records and information in child of need of care cases. This bill first amends a subsection, or adds a subsection to KSA 382212, which is a statute that identifies who can access DCF confidential agency records. And this section would direct the department to disclose confidential agency records of a child alleged or adjudicated to be a child in need of care to the law enforcement agency investigating the alleged or substantiated report, regardless of the disposition of the report or investigation. And the information that would be included in this disclosure would be limited to things like reports, investigations, past reports regarding the child or their siblings, and alleged perpetrators. And another statute it amends is KSA 382210, which includes a reference to the required disclosure in the first section. And this bill would also add an investigating law enforcement agency to the list of persons who can access the official file in a child in need of care case pursuant to the code, and the social file of a child in need of care pursuant to the code. And I will note that there's a mirror of this House bill that had a hearing, and that bill is House Bill 2582. It had a hearing in House Children and Seniors and did pass out with amendments that were recommended by law enforcement. And I believe if Ed's testifying, he should be able to give you more details on that if you'd like. And I'll be happy to answer any questions about Senate Bill 425. Oh, and this was a recommendation from the Child Welfare Oversight Committee.
Thank you for that, Jenna. Committee questions? Seeing none, thank you. Okay, committee, now we will turn our attention to proponent testimony. Our first proponent is Secretary of DCF, Laura Howard. Secretary Howard, welcome to the committee.
Thank you, Mr. Chairman. Laura Howard, Secretary for Department for Children and Families. I do stand here today before you as a proponent of Senate Bill 425 related to information sharing and data transmission between DCF and law enforcement agencies. As the revisor indicated, this was a recommendation that came out of the Joint Committee on Child Welfare System Oversight. After that committee met this summer and fall, we worked closely with Ed Klump, who represents the Kansas Association of Chiefs of Police and the Sheriffs and Peace Officers Association, to create this new testimony and work closely with the revisor. What I would say is that historically, the statute that's currently in place has been interpreted differently over time by different DCF administrations and frankly by different attorneys probably sitting within the DCF agency. So sometimes that's led to an inconsistent approach to what I think the current statute actually always intended, which was free exchange of information between DCF and law enforcement. In my tenure, we have certainly interpreted the statute to mean that free exchange of information without redaction to really expedite processes for both agencies. And in fact, about a year ago, we created a new statewide form that was specifically targeted to sharing information with law enforcement, really trying to get get to some uniformity. But I think we even learned, even during the interim process last year, that that wasn't always used consistently across the state. So the mutually agreed upon solution was to say, let's just create some very clear statutory language so this isn't subject to interpretation now or in the future, that would very, very directly address the free exchange of information between DCF and law enforcement. I think as written, this bill solves any current or future interpretation issues because it explicitly states that DCF and law enforcement shall have a free exchange of information during any investigation of a child who is alleged or adjudicated to be a child in need of care. So again, the bill would clarify that, would direct DCF to release certain information, and we stand in support of it. You will hear a proposed amendment from Mr. Klump, and I just would say in my testimony, we are in support of that amendment. We think we would interpret the bill to already require us to do those things, but again, in the guise of having as much clarity as possible, we're in support of the amendment that he will propose in just a few moments, Mr. Chairman. Thank you.
Thank you, Madam Secretary, and we will hold questions until after all conferees have had an opportunity to give their testimony. Committee, our next proponent is Ed Klump.
Thank you, Mr. Chairman, committee members. My name is Ed Klump. I'm here on behalf of the Kansas Association, Chiefs of Police, Kansas Sheriff's Association, Kansas Peace Officers Association. I want to just give you a real quick history of how we got here. This is an issue that has been troubling our investigators for years. I've probably been working with different DCF administrations over 10 years trying to fix this issue with lack of clarity in the statutes. We were invited on October 5th to testify in front of the Joint Committee on things that we were struggling with our investigations of child abuse and neglect. And so in preparation of that, I had taken a list of things that investigators would call me all the time saying, I've had this problem, I've had this problem. I took that list and put it in a survey, and I just simply asked only for our officers that were investigating child abuse and neglect cases on a regular basis, have you had an issue with this particular item in the last 12 months? Because I wanted to narrow it down. I didn't want to go too far back. And what we found in that is most of those responses came back that plus or minus a little bit, about 50% of our investigators had issues with every one of those points that had been reported to us. And that told us there was an issue we needed to fix. Over the years, we've been in discussions with DCF over different things, and one of the things that I had noticed in those discussions is it always came back to, well, you know, yes, that statute says you get this, but you go back to this specific statute on that information, and law enforcement's not listed in this long list of groups that has access to that information, so we don't think you get it. And then sometimes they'd say, well, yeah, you do get it. And then sometimes they'd say we don't. So what we did in this, we wanted to have something in statute, like the Secretary said, that clearly stated specifically for law enforcement what's going to be shared, and take away those interpretation issues. And so that's what we did. In preparing that and preparing for our work with DCF, I put together a smaller group of our investigators from across the state representing both big agencies and rural agencies, and we worked with them on identifying what needed to be in this bill. And so if you look on page 6 of the bill on line 7, where it starts out, such records shall include, that's kind of a list of the things that we were having trouble sometimes getting access to. And so that section there is the section that developed out of that specific for law enforcement. We think this is going to add a great deal of clarity into the interpretation, and we feel very confident this is going to fix a very long-standing problem we've had that has hindered some of our investigations into abuse and neglect over the years. But we want to say that's water under the bridge. When this bill passes, we think that's water under the bridge. We want to look at the fresh water coming down the stream. We do recommend an amendment. I have that at the bottom of my testimony there, and that is to add a few more things that my group of investigators came back after looking at the bill and said, you know, these are big issues that we are having problems with. We'd like to see that in the list. And I agree with the Secretary. The wording probably covered that, but again, it's up to interpretation. We want to take that out of the picture. So we'd ask you to make that amendment. And Mr. Chairman, I'll stand for questions at the appropriate time.
Thank you, Ed.
How'd I do? Did I get 3 minutes or?
So far, we have 2 applauses, so Secretary Howard was pretty on the spot as well, so, yeah. Committee, next, we have Scott Zimmerman, Mound Ridge Police Department. And he is with us virtually. Scott, welcome to the committee.
Thank you very much. Chair of the Senate Public Health and Welfare Committee, I want to thank you for the opportunity to provide testimony in support of Senate Bill 425, which would require the Department of Children and Families to disclose agency records of a child alleged or adjudicated to be a child in need of care. I'm testifying today in support of Senate Bill 425 on behalf of the Kansas Peace Officers Association and myself as the captain assigned to investigations for the Mound Ridge Police Department. Senate Bill 425 directly addresses the shortcomings of the current statutory language. DCF currently only shares limited information with law enforcement. DCF is currently screening reports and deciding which reports go to law enforcement. And at the current time when law enforcement receives a report, there's often information which is redacted, which can be crucial to a proper investigation. While it's impossible to know how many reports have been screened out by DCF and are not reported to law enforcement, I have an example of how this is not beneficial to our communities. And I think this example will illustrate why reports should be shared with law enforcement. Recently, I received a call from a DCF employee. They were wanting to check the background of a particular family to ensure that they had not been a suspect of or had any criminal case with our agency. During my conversation, the employee explained the investigation they had performed. I was told the child had been allegedly strangled to the point their voice box was cut off and the child could not speak during the time the abuse was occurring. The employee went to the home, interviewed the child and the parents, and found nothing was suspicious and deemed the case unfounded. This case should have been investigated by law enforcement first and foremost, and the child should have been interviewed by a trained forensic investigator who specializes in interviewing children who have been traumatized. The alleged perpetrator should have been interviewed in a formal setting, and more follow-up should have been performed. By not interviewing this child in a forensic setting is completely unforgivable. By not involving law enforcement from the beginning of the investigation, DCF will and has compromised the integrity of this investigation by losing valuable evidence and allowing the alleged perpetrator time to coach the victim on their responses to certain questions. The delayed reporting and redacted reports provided by DCF in the past is unacceptable. The children and families deserve better service from those of us who watch over them. And had DCF contacted law enforcement from the beginning of many investigations, valuable time, evidence, and resources would have been saved. There's absolutely no reason not to support Senate Bill 425. It will provide a better outcome of cases and help those who cannot always help themselves, primarily our children. I thank you for your time, and I'll stand for questions when you request.
Scott, thank you very much for your testimony. In committee, all 3 proponent testimonies did come in under 3 minutes, so thank you. There's your round of applause. So, committee, we do have proponent written only testimony. Rachel Marsh, Children's Alliance of Kansas. And with that, we will open up for questions for any of the proponents that had testified. We do not have any opponent or neutral, so just to make sure we did not miss anybody. Was there anybody that wanted to provide testimony as an opponent or neutral? Okay, not seeing any. Committee, questions for the conferees? Senator Gossage.
Mr. Chair, I would just like to thank the parties. We did hear this in child welfare and ask that you come together, and you did. Again, another applause. Thank you for doing that. I'd like to see that more often, and I stand in favor of this bill and the amendment. Thank you.
Senator Petty.
For those of you who don't know, we had a mic issue, and we still do. This is a question for Ed.
Yes, ma'am.
And Ed, thank you for being here concerning this bill today. One of the things that I've seen in the past in these situations concerning children is, and in this bill deals specifically with information that's going to come from DCF to law enforcement. And I'm just curious about the other way, because there have been, and sadly, 2 very major cases that have occurred in my district that led to deaths. And it seems to be that there was a lack both ways. So could you share with us how that's going to work?
Sure. There's a different statute that kind of talks about the law enforcement exchange, I think, with DCF. We haven't really seen a big problem with that. I mean, anytime we're dealing with people, you're going to have failures sometimes. But in our discussions, there was nothing identified that needed fixed in that statute because I was concerned about this being a two-way thing, and if they had concerns, I wanted to be sure we fixed those as well. We do exchange the reports with DCF. I can tell you occasionally we have an issue with that, but it's a process issue and it's not a statutory issue.
Thank you, because that, I think that's very important to understand that sometimes the perception is that it's not, it's both parties, and it's not just one way or the other that information hasn't been shared.
Right. These are difficult cases, and to be fair, there's a lot of them. And DCF gets many reports on this that have to be looked into. But sometimes those cases come directly to us before DCF gets them, and we report them to DCF. Sometimes DCF gets them and we get them. And, DCF has the focus and the training to look at the civil side of how do we deal with this child and put them in a safe place and making sure we're doing the right thing there. And law enforcement is focused on the criminal investigation. And so when we work together, we have the best outcomes. And what we're trying to do in this bill is just enhance our ability to work together. There's just so much of this information that's critical for us to have that we've been missing in the past. It's led to delays, and I think led to some of the case problems that you're talking about. But we're all dealing with people, and we try to reinforce this the best we can with our people.
Committee, I do not see any further questions for any of the conferees. So we will close the hearing on Senate Bill 425 and open the hearing on Senate Bill 453. And with the Revisor's Office, Jenna Moyer will give us the bill overview. Just to back up just 1 second before you get started, we are going to plan on working these bills that we are hearing this week. Hopefully, if we don't get them done this week, we are planning on working Friday. So please make sure you have amendments. If you have amendments, get them to Jenna so she can have them ready so we can get these worked. So if we do not get them worked before Thursday, we are planning on working bills Friday. So Jenna, thank you.
All right. Thank you, Mr. Chair, members of the committee. Senate Bill 453 is about training for unlicensed employees of adult care homes. The first section it amends is KSA 39936, and it relates to unlicensed employees of adult care homes. And these unlicensed employees are already required to take 40 hours of training in basic resident care. And this bill would add that the instructors of that 40-hour training course would need to be licensed and in good standing to practice in this state as a licensed or as a RN, registered nurse, et cetera. And instructor, if you had multi-state licensure privilege, that would also count. And the next change in the bill would allow a simulation experience to be used in the clinical instruction portion of that 40-hour training course. And if the course is in two parts, then the simulation experience could be no more than half of those clinical instruction hours. And after completing the training course, the unlicensed employees would be required to demonstrate competency in a list of skills that are identified by the Secretary for Aging and Disability Services. And that skills demonstration would also need to be evaluated by a registered nurse. And the rest of the bill changes are just updates to, or technical updates to outdated language. And with that, I will be happy to answer any questions.
Committee, do we have questions for Jenna? Senator Petty.
Jenna, as I looked over this bill, I was noticing on page 3, starting in line 22, when it talks about the same examination given by the Secretary for Aging and Disability Service to all unlicensed employees of adult care homes who provide direct individual care to residents and who do not administer medication. I'm curious as to how is this different from a CNA?
I mean, a CNA would, or excuse me, thank you, Mr. Chair. A CNA is required to have that, they have that, they have the certification, a certified nurse's aide, and so they would not be under the guise of this statute. And hopefully there's a proponent that can give you more details on the specific skills that these unlicensed employees would give, but this bill would not cover CNAs because they're not unlicensed, that they already have regulation.
So I think we will hear that from opponents about that. So just that there's a clarification that this doesn't jeopardize or interfere with CNA training in any way within this bill. So I think that's...
Those employees may be allowed to attend this training, possibly as a continuing education, but it wouldn't be, that's not within the text of this bill, just that it may be an additional training opportunity, but it would not add any other requirements to CNAs.
Thank you.
Okay, committee, not seeing any further questions. Jenna, thank you for that. We will now turn to proponents, and for everyone that is testifying, you do not get the applause if you stay under 3 minutes, because that is your time limit of 3 minutes, because we have 7 conferees on this, but you will gain favor with the chair if you stay within your 3 minutes of a smile. So our first proponent is Heather Porter, Chief Nursing Officer of NMC Health. And Heather is with us virtually. Heather, welcome to the committee.
Thank you, Chairman Hildebrand and members of the Senate Public Health and Welfare Committee. On behalf of NMC Health, we appreciate the opportunity to provide testimony in support of Senate Bill 453. My name is Heather Porter. I'm the Chief Clinical and Chief Nursing Officer at NMC Health. And my career began as an LPN, and I've also taught numerous certified nurse aide classes over the years for long-term care facilities as a registered nurse. Thank you for your leadership and consideration of our comments today. We know that there is a current nursing shortage of RNs. The Bureau of Labor and Statistics projects 1.1 million new registered nurses will need to be replaced this year, and that was prior to the pandemic response. It also reports that Kansas is one of 5 states with the highest concentration of nursing assistant jobs available. By supporting Senate Bill 453, additional instructors and courses will be available to expand upon the number of certified nurse aide courses in Kansas. Certified nurse aides are a vital component to safe delivery in a hospital and long-term care setting. Scarcities in this workforce are detrimental to workforce strategies for healthcare institutions in Kansas. A licensed practical nurse scope of practice allows an LPN to be assigned work by an RN in the area of supportive restorative care. An LPN scope of practice aligns with providing education on key domains such as grooming, eating, toileting, transferring, and ambulation. Those activities of daily living are key components of a certified nurse aide's work. This bill comes at a time when the healthcare industry is in desperate need of a stable and well-trained workforce. Certified nurse aides are critical to that overall delivery of healthcare in the communities across Kansas. Finding a creative way to expand opportunities for those interested in joining these programs and to be trained and ensure that those students have access to getting trained in the field is really important in addressing current and future workforce needs. This bill allows for greater flexibility. It eliminates barriers to expand CNA training and opportunities in Kansas. And it allows for flexibilities for instructors in these courses so more Kansans can take this course necessary to enter the field. Allowing the use of simulated labs for training means more hands-on trained workforce that will have access to field training options deemed safe and effective by researchers. And expanding qualifying experience for those that are caring for the elderly, no matter the clinical setting, means more RNs can administer the skills portion of the CNA competency and is correct in the recognition of the healthcare staff takes of the elderly and chronically ill in settings across healthcare, not solely long-term care. Thank you for your consideration of our comments, and we ask that the committee recommend favorably Senate Bill 453. I would be glad to stand for questions at the appropriate time. Thank you.
Heather, thank you for your testimony. We will hold again for questions until all proponents have had an opportunity to speak. Committee, our next proponent is Jason Watkins, Wichita Regional Chamber of Commerce. Jason, welcome to the committee.
Jason Watkins, Wichita Regional Chamber of Commerce. You have a lot of experts here today. I am not one of them, so I will be very brief. Chamber supports this legislation because it's a common sense solution to a problem that our members are experiencing, both our long-term care providers, and I think you're also going to hear from somebody from Wichita State today that not only are we suffering from a shortage of CNAs, our educational institutions want to train, but are having problems finding RNs that can teach these courses. So this is a common sense solution, and we would urge that you report it out favorably. And I will stand for questions at the appropriate time, although I would not be able to answer them.
Jason, thank you, and you will probably get the majority of the questions after that. So, committee, our next proponent is Robert Miller, Senior Vice President of Comfort Care Homes and Comfort Keepers of Wichita. Robert, welcome to the committee.
Good morning, Chairman. Thank you very much. My name is Robert Miller. As he said, I'm Senior Vice President of Company Development for Comfort Care Homes and Comfort Keepers. This is in Wichita, Kansas. I'm a licensed master's level social worker, focused practice on case management and senior populations. And I've done this for about 20 years. I've worked in hospitals, home health, hospice, and now long-term care. There are a lot of people here that have far better handle on the workings of policy and regulation. My job today is to help you focus in on the front line of care, in particular, long-term care environments like assisted living centers, home pluses, and memory care, which is what I do. And so, how Senate Bill 453 can help make a difference at this critical time in our state's needs for professional caregivers is apparent. Comfort Care Homes operates 11 homes between Wichita and Newton in Kansas, serving up to 120 residents, employing about 130 people top to bottom, and 95% of that are direct care staff. I get to see the I get to see the rewards and the rejections, the sweat, the tears, the fears, and the moments of joy that our care staff create every day. We care for people with Alzheimer's and other forms of dementia from early stage to advanced dementia. We guide families through the struggles to figure out what to do next and when to do it. No simple task for Kansans, just trying to do the right thing for their loved one. Imagine trying to function with 30 holes in your weekly staffing schedule at the height of a pandemic. Then imagine my frustration and awe when I heard that WSU Tech had to turn away 200 students in the fall of 2021, not because of lack of scholarships, not because no one was applying for the programs, because they did not have enough qualified instructors under the current state definition of course instructor. And then another 300 students in January. That would have been 500 CNAs that could potentially have been in our workforce by about March of this year. In time, when this came in a time in which we were begging people to come to work, either because they are scared, they're tired, they suddenly can make more money at the corner burger store, or they're just sick of it all. I don't get the choice. Comfort Care Homes does not get the choice. We're 24/7. If businesses like ours close their doors, it would be a devastating effect on our community. And there are examples of businesses like mine that have had to close down their doors because of staffing. The individuals entrusted in our care cannot just go home or even be left alone. They need presence, they need physical care, and their families deserve peace of mind that we have a place and a plan, even when there are 30 holes in the schedule. That is why I'm standing here today. We can do better. We have the ability to make logical changes to the definition of a CNA course instructor, expanding it to allow qualified LPNs as a part of that process. Thank you, Chairman. I know we'll stand for questions if called upon.
Robert, thank you very much for your testimony. Committee, our next proponent is Sheree Utesh, President of the Wichita State University Tech. Sheree, welcome to the committee.
Thank you, Chairman. Good morning. I'm Sherry Utash, President of WSU Tech and Vice President of Workforce Development at Wichita State University. Two-year colleges across our state that are engaged in teaching career technical education are a microcosm of their communities that they serve. And as we educate and we train an entry-level workforce in many different industries, and we do spend a lot of time with industry, whether it's aviation or manufacturing or IT or applied technologies, and today we're talking healthcare, to try to help industry find solutions to their talent pipelines. And so one of the things that we've been doing is trying to figure out how do we somewhat work with industry to modernize some practices so that we can create a vibrant talent pipeline of CNAs into our communities. So the result of some work of different industries and education and associations together have presented this bill, Senate Bill 453, for you, which kind of allows a modernization of existing regulations. Number one, using LPNs to teach CNA courses under the general supervision of a registered nurse. Continuing the practice that was allowed for us as educators to use up to 50% of simulation for clinical experiences, and that was a regulation that was given to us under COVID that we would like to continue to use. And then finally, having RNs with experience in caring for the elderly or the chronically ill at any age to administer the skills demonstration portion of the CNA competency evaluations, regardless of where they received that care, that experience in any setting. So at the end of the day, we want to help the industry be successful. We want to make sure that we're taking care of those citizens across our state in all of our communities that need this critical care. It's a critical workforce need. Higher education stands ready to help, but we do need some help in modernizing the way that we hire. Thank you for the opportunity. Happy to answer questions should they arise.
Thank you, Sherry. And committee, that does conclude our oral proponent testimony. I would like to draw your attention to 16 written-only proponents. And at this time, we will open up for questions for proponent testimony. Senator Baumgartner.
Thank you, Mr. Chair. Could someone share with us what the number of hours of training are required for the LPN versus the RN? And then also, I'd like to know, because it indicates that the LPN will be doing the instruction, but there would be oversight from a registered nurse. So how exactly does that oversight? Is that the same as in a school? You have your teachers that are in the classroom, and there's oversight provided by the principal who's in a separate office? Anybody? Okay. So my next question.
We do have someone, Rachel Munger with Leading Age.
Hi there, Rachel Monger with Leading Age Kansas. We can find out the number for you on the RN versus LPN. On the general supervision versus direct supervision is really what we're talking about when we talk about RNs and LPNs being instructors. So that would vary by school, I believe, but we can find some more details. But obviously, general direct supervision would mean that the person is there, as you described, like in a classroom with the teacher there and then supplementals. So this would be general supervision by the RN, so they would not always be there when the LPN is doing the instruction. They would not be there in person.
And if I might follow up, I have a couple more questions. So you said it would vary by school. So what are we talking about schools? Because we heard reference to community colleges, and yet community colleges are testifying as neutral, but the testimony came from a technical college. So is this in the school, or is this in the nursing home facility? Where is the school?
There is a variety of entities that are allowed to do CNA training. So there is technical colleges, there are community colleges, there are private colleges and allied health centers, and then nursing homes themselves can also do CNA training.
Okay, I guess I'm concerned about how varied that would be from institution to institution, or from nursing home or facility to facility. It does seem like there is a lot of reliance also on that, the clinical being the simulation, so 50% of that would be simulation, is that right?
Up to.
Up to 50%. So I guess part of my question is, how much simulation training do LPNs have compared to registered nurses? And I think it's significantly different.
That one, yeah, I would have to go back and check.
Sherry, if you could restate your name and who you represent.
Sherry Utash, president of WSU Tech. I want to go back to your first question. I don't know the exact number of hours, Senator Baumgarten, but I do know this, that those hours are all prescribed by the Kansas Board of Nursing. So the LPN program has a prescribed number of hours and curriculum from the Board of Nursing, as does the RN. Now, you are correct in the fact that for LPNs, there's a greater amount of hands-on clinical practice. There's a higher amount in the LPN versus the RN versus the BSN, certainly. And so the number of hours, but the number of training hours for those programs are extremely similar, because one of them is a year program and the other one is a year and a half. So they're going to be very similar. As far as simulation, the simulation would be up to 50%. It wouldn't have to be 50%, but it would give us the leeway, should we be back in some kind of a situation like the pandemic, to be able to easily pivot to that instead of having to wait for emergency declaration. The other thing, when you talk about the oversight would be that those skills checkoffs would be done by a registered nurse. The real essence of the change is that it allows us to employ LPNs to help with the work ahead of the skills checkoff with the registered nurse. And there's a lot more LPNs available to try to do this work. And if you go into any of these care facilities, the correlation or the partnership and the working relationship with the CNA is directly to the LPN, and the RN does a checkoff. So it's kind of taking that same approach of practice into the classroom.
I appreciate that statement. I don't know that I agree with that statement. I don't know that I agree with that statement, because there is a significant difference, and let's get back to the classroom situation. There is a significant difference between a licensed teacher and a student teacher. Vast amount of difference. And so that's why there is that requirement for the additional hours. I'm also concerned about the limited amount of hours that LPNs have with those simulation labs to then be teaching using that criteria. So,
well, in the Board of Nursing, you can go up to 50% of simulation in your LPN and RN program as well.
My point is the RNs are teaching the simulation. Thank you, Mr. Chair.
Senator Petty.
Thank you. And Sherry, you can stay there for a second. You just mentioned a moment ago about there are a lot more LPNs than there are RNs in the state of Kansas. Do you have those figures?
I do not have those figures, but I do know from a hiring process that we have a lot of LPNs that are that would like to be teaching in this area that don't have their RNs yet, or they may be working on their RNs at the same time.
So if you could, or provide that information, that'd be helpful about, when you say there was a lot more, to see that number. And thank you. I have a question for Heather Porter. Right. Oh, was Heather online? Heather, are you still online?
Yes.
Heather, you referred to these courses as the same as CNN, so are you under the impression that this is training for CNNs?
For certified nurse aides, yes. I'm speaking to the part of the bill in support of that LPNs would be allowed to provide that education for the certified nurse aides.
I noticed in your testimony that there seems to be, I don't know if it's disagreement or a lack of agreement concerning who should be teaching. I'm sorry, go ahead, Heather, sorry.
I would be glad to provide clarification. I'm supporting, NMC Health is in support of the LPN providing those clinical skill checkoffs, because that is a big part of their scope, is grooming, the activity of daily living with that RN oversight. And that was the amended piece of the bill that we were supporting, is that it allowed the LPN in conjunction with an RN to provide that education so that we could offer more classes to certified nurse assistants and increase that pipeline of worker. Does that answer your question?
Yes. So you're seeing this as being, it seems to be a little unclear in this bill. It refers to unlicensed employees, that's the same as a CNA, and so you're referring this as the same as a CNA, and so we're really talking about CNA training.
Right. I'm speaking to the CNA training in support. Let me see if I can I'll follow up with the line item for you, Senator, where it speaks to that the LPN in conjunction with the RN can provide that certified nurse aide training.
Thank you.
Senator Erickson.
Thank you, Mr. Chair. Thank you all for being here today. I apologize if I missed it, but did anyone address, are there other states that allow LPNs to train CNAs? And if so, is there any data around quality of care? Has that affected that, or how that's alleviated the demand for CNAs? Is there any other state that we kind of have as an example in this area?
Thank you, Senator Rachel with Leading Age Kansas. The state we know of, I'm not saying it's the only one, the one we know of that's around us is Oklahoma does allow this. I have not seen any studies done on that, but I also have not looked closely, so we will look at that and see if we can find anything for you.
I think that would be helpful. Thank you, Mr. Chair.
Senator Steffen.
Thank you. Now, just to make sure we're on track here, we're talking about LPNs training unlicensed employees, not CNAs, correct?
Yeah, so this is a tough, awkward one with this bill. In our adult care home statutes, all it says, and it was passed a long time ago, decades ago, I believe, all it says is that if you want to provide direct care to residents of adult care homes, you will be an unlicensed adult care home employee with 40 hours of training. That's not a thing. We have not for a very long time. None of our training programs have 40 hours. We don't ever refer to unlicensed adult care home employees. To us, and what it's always been, is that's code for nurse aide and a certified nurse aide training. All of our state regulations are for nurse aides, and that's what we use as direct care workers in adult care homes and also across the healthcare spectrum. And those nurse aides, this is when it gets complicated too. And those same nurse aides that can be used in nursing homes are governed really by CMS regulation. And so by necessity, Kansas has matched all of their nurse aide direct care worker training to federal certified nurse aide regulations. And so when you see in our testimony saying we want to be able to allow LPNs to act as instructors under the general supervision of a registered nurse, those are allowed under CMS regulations. And so we're asking for our state regulations to match those already strict federal. Does that make sense? Do I need to get out a chart possibly and a whiteboard?
Follow-up? Yeah, thank you. Okay, I think it does, but you're telling me that in most universes, an unlicensed employee equals a CNA. Is it that way in every circumstance?
When you're talking about long-term care, yes. Now, we have some more informal positions that usually are also always CNAs too, but maybe you could have a hospitality aide and they don't actually provide direct care. They may bring someone a glass of water or something. But in general, if you're providing direct care services, especially in long-term care, it's a CNA, yeah. And so if we would want to change adult care home statutes and instead of saying unlicensed adult care home employee, it said certified aide, we would be fine with that because that is the only thing we use and the only thing we are allowed to use to provide direct care services to residents in long-term care.
Thank you. I see, as I was reading ahead a little bit, that an opponent refers to evidence supporting an association between higher training hours and improved resident care outcomes. Can you elaborate on that?
Sorry, which testimony was it?
I don't think it matters. It's just that statement that there is evidence that supports an association between higher training hours and improved resident care outcome. Do you know anything about that?
I don't know what study that refers to. Sorry.
Rachel, I have a question, and you might be able to clarify this, but I do believe that this position that we are talking about today has already been in practice via pen and paper by the governor's executive orders. Am I remembering correctly?
No, under the executive orders, we are doing temporary aids, and that's a whole other thing with like a very limited training that's online. We are not seeking in this bill or in general to make that permanent. What we are doing is we're hoping that bills like this will actually make it so that we don't need to rely on temporary aids or that we can find more ways to reduce the use of that even in the year or so that we may be allowed to use them. We are trying to find ways to make CNA training more accessible and keep the quality there, keep the number of hours. We're not changing that. We're not changing in the curriculum. We're not changing the exams they still have to pass. We're not changing the competencies we still have to pass. We're not changing who gets to judge whether they have achieved those competencies. The fixtures that we're looking for are very narrow. They are logical. They match, all importantly, CMS requirements for CNA training. And we really think that this is the best, most logical, greatest path forward to extend that pipeline. And as I think you've heard in a lot of testimony, it's not even just long-term care. CNA is a prerequisite for LPNs, RN programs, home health aides, medication aides. They've become extremely important to the entire healthcare system. And so that's why we are bringing this bill forward today, knowing how important that is, especially at this point in time for healthcare.
Senator Stephan.
Thank you. Does this bill cause a problem with the scope of practice of an LPN in Kansas? Does it potentially put the RN's license at risk based on terminology within?
Well, I am not a lawyer with expertise in that type of thing, but what we've heard from the nurses that are involved in our coalition, it does not. We saw the neutral testimony from the Board of Nursing, and they would like some clarification, which is fair, and I think the type of clarification we usually see in regulation, particularly for CNAs when it's all in regulation. But I didn't see anything in the Board of Nursing testimony that said it violates scope of practice either. I'll be wrong, obviously, if you want to call me out on that, but I didn't see that in the Board of Nursing testimony.
Was the Kansas State Nurses Association not engaged in this process of this bill's development?
We did check with the Board of Nursing. I know I
think
did
that-
once,
I'm
but.
sorry, the Kansas State Nurses Association.
No, they knew about the bill. No, we did not involve them in the process of writing the bill, no.
Though they wanted to be involved.
I don't know. I didn't receive that specific request from the State Nurse Association. I know they have an opinion on it, obviously, but no, they were not part of the coalition that drafted the bill.
Committee, thank you for the questions. We do need to move on. We are going to move to opponent testimony. We have two. Kelly Summers, Kansas State Nurses Association. And Kelly, I apologize, questions did go long, so keeping it under 3 minutes is very, very relevant from
It's
here on
quite
out.
all right. And could I say beforehand that I am happy to answer all of the questions that were asked to the proponents of this bill, because I actually do have answers when I come forward today. I'm director of the Kansas State Nurses Association. Likewise, I have my BSN RN, and we are constituent members of ANA, which is the largest in the country. We are the largest nursing association within our state. We do a lot of collaboration on any issue that comes forward, not only with nursing, but any advocacy for those that receive care from us, which would include all of our Kansans, because we take a vow to do no harm. And that's why I'm here today to oppose this bill. This is going to allow an unlicensed, unsupervised individual with no care experience, no required background check for 60 days, no fingerprinting, no agency oversight, to provide direct, skilled care to any senior and long-term care industry. And ADLs, and I want to make this very clear, are specifically defined as skilled care. So when we're looking at ADLs, if we're looking at a transfer of a patient, let's say out of a bed to a wheelchair, we have to keep in mind that it's not only dementia or Alzheimer's that somebody has. There could be one-sided paralysis, there could be contractures, there could be a lot of involvement in this whole process. And it's not easy. Those highly skilled CNAs right now, their work is hard. So, and I'm sorry, I'm shaking right now. And then the other piece to this is there is that TNA position within House Bill 2477. It was actually under the old executive order. There's no data in place, by the way, from KDADS to even track what happened under the old executive order, nor have I been able to get an answer from KDADS on how they're currently tracking information. But I will say that if we've already have this position in place, why aren't long-term care businesses training those CNAs right now to be CNAs? It makes absolutely no sense to me. I mean, I've already heard a bill from the same individuals that want to cap nurses' pay, and they also want to put our seniors at risk for inadequate care. And then the other question, because there's more questions than answers, as I think you very well are now knowledgeable of because of the lack of answers that have been put forward. But anyway, and I have a question about this overabundance of LPNs and why they're not hiring them to provide direct care, but instead complaining about hiring agencies right now. So I appreciate your time, Chairman Hildebrand and committee. I'm sorry I didn't address you initially on this, but I took a lot of notes and I'm happy to answer any questions afterwards. Thank you so much for your time.
Kelly, thank you very much. And sometimes it's okay if I'm not addressed because sometimes it's kind of awkward of what they say. So thank you. So our next opponent testimony is Mitzi Mcfatcher, Kansas Advocates for Better Care. Mitzi, welcome to the committee. And if you could please keep it under 3 minutes, that would be very, very appreciative.
I'll do my best. I'll talk quickly. Chairman Hildebrand and members of the committee, thanks for letting me be here today. My name is Mitzi Mcfatcher. I'm the director of Kansas Advocates for Better Care. We advocate for all older adults in all care facilities in the state of Kansas. We are standing in opposition to the bill today for really 6 basic reasons. So I'm just going to outline what those are. The first is that this bill won't meet the needs of older adults for safe, competent, hands-on care from certified nurse aides. And it won't improve their competence or maintain the level of competence we currently have for CNAs. When we talk about using 50% simulation lab training, I'll just tell you, from having taken care of my brother-in-law who has Parkinson's, you never know when he's going to fall. You never know when he's going to hit out. That's just a muscle reaction. You never know when he's going to address you in a way that is something you're not anticipating. Simulation labs won't teach you how to respond in those situations. It won't teach you how to decision make in those instances that you are dealing with the needs of people who have dementia, Parkinson's, and who are just generally frail. The second reason that we are opposing the bill is that the bill language is both vague and it leaves important requirements undefined in quantifiable measures. And I want to just point out several things that I'm talking about there. Even though Kansas requires 95 hours of training for certified nurse aides, this bill only talks about 40 hours. So where are the other hours that are required? This bill also uses a phrase, "in good standing," when they're talking about the licensing of the person who would be providing the training. But that's not defined in this statute, and it's not defined in another statute that's referenced in this bill. That's very important. In KDAD's regulation, the way that they talk about it is a person who has no pending or current disciplinary actions. With regard to the multi-state licensure piece, they talk about adverse actions and encumbrances. Those are important things for us to know about who's providing the instruction to CNAs who are providing the direct care. And the other thing that I would mention is just the scope of practice, which Ms. Summers is much more equipped to talk about than I am. We talk about the lack of staff in nursing facilities, and that is true. And what we hear from nurse aides is that they feel under-equipped, and they feel under-trained, and they feel under-supported to do the job they do. This bill isn't going to stop the churn of CNAs that come into and quickly leave facilities because of those issues. And finally, I would say, Senator Gossage mentioned on the prior bill the importance of people working together. One of the reasons that you're hearing such strong and varying opinions today is because that did not happen on the language in this bill, even though for decades, KDADS has been in the position of bringing people together to look at health occupations credentialing for unlicensed workers in care facilities so that we can talk through these kinds of issues and come to agreement in regulation or for statutory changes. The last thing I would say to you is that the Secretary of KDADS already has flexibility that means that this bill isn't actually needed because it's only in certain geographic areas of the state that there are challenges in finding the registered nurse instructors that are needed for the CNA classes. Both the community colleges and KDADS have indicated that there is flexibility to address the concerns. So this bill is not needed. So on behalf of the older adults who are receiving care from direct care workers, I would like to say to you, this isn't a good bill for us. It's not a clear bill, and it certainly weakens the requirements for training that aides are asking for. Thank you.
Mitzi, thank you for your testimony. Committee, we do have a written-only opponent testimony by Camille Russell, Kansas State Long-Term Care Ombudsman. And I'm going to hold questions for opponents. We have one more oral testimony, neutral. We're going to go ahead and go to that, and then we'll go back to questions. Heather Morgan, Association of Community Colleges. Heather, welcome to the committee. And if you could be very brief. Thank
I'm
you.
quick. Thank you, Mr. Chairman. I am Heather Morgan. I'm here today representing the community colleges, and I've never testified on a bill that has such strong feelings on both sides, even within our 19 community colleges. I hope you can read my testimony. Because I know so little about this, I copied and pasted what the professionals who are actually teaching these courses every day say, and the directors of our nursing programs. The bottom line is this: there are some people who'd like more flexibility related to LPNs. Everyone who wants more flexibility wants to make sure that there's good direct oversight by those RNs. If we do not train our CNAs properly, we're going to have problems upstream in our healthcare system when they go on to be an LPN or go on to be an RN. I did get some phone a friend help. We do have more RNs in the state. Basically, our schools also want to make sure that we address some very highly credentialed healthcare professionals who currently can't teach CNA class because of that long-term care exception. If there's any ways we can work with the federal government or CMS on that. Moving right along, we do have strong disagreement on the simulation portion. KDAD's worked extremely well with us during the pandemic to allow up to 50% simulation. That's the same thing the Board of Nursing did. But simulation to me does not mean the same thing as simulation to someone else. When we talk about simulation, we're talking about hands-on, in-person with mannequin simulation, not online simulation, not somebody teaching a simulation who's never been trained in the pedagogy of doing that. It's awfully hard to, as Mitzi was just saying, to see people's faces and things like that. And so the quality of care is really important in making sure that we have from top to bottom, from our private providers to our actual schools, we have the oversight by those RNs of the people who are teaching the class. I'm going to skip ahead and say that, as others have pointed out, this is all about certified nurse aid training. Currently, we have there are 90 hours of training, and then there's 20 hours that are the basic skills, 20 hours that are the skills checklists. Those are the 40 hours we've been talking about. There's another 25 hours of clinical lecture, another 25 hours of specialized clinical training. So this is really about 90 hours, and we're only talking about 40. Our nursing programs were incredibly confused by the bill and did not understand exactly what was going to be happening through this. And so the more clarification we can provide them to make sure they're doing what you all want them to do, that would be appreciated. And I'm happy to stand for questions at the appropriate time. Thank you very much.
Heather, thank you. Just one quick question. When you did your phone a friend, which phone did you use? I noticed you have two. Did you use the right one?
Bigger.
Okay. And committee, I do apologize. We are over and we are out of time, so we do not have enough questions for opponents. If you do have questions, opponents and neutrals, if you would be willing to allow us the levity of sending you via email and answering back as quickly as possible. Thank you, and we are adjourned.